Hello there. If you're watching this, you most likely just had a knee surgery that required an incision that's bigger than the small poke holes of just a knee scope. So something like an ACL reconstruction. We wanted to go through this and show you exactly kind of what to expect for your post-operative instructions. So before we get started, I just want to thank you because you entrusted in me to get you back to your active lifestyle. So now let's take a look at your dressing. So this dressing right here that you'll have after your surgery is waterproof. It's actually pretty mobile and pliable and allow you to bend with it on. And the goal with this is to keep it on until we see you in clinic. That's why everything underneath it's going to be sterile, and it's going to help keep things nice and sterile so we don't have to worry about any sort of infection after surgery. So now I wanted to go over your brace and your activity after your ACL reconstruction or bigger knee surgery requiring a brace. So the first thing we want to come look at is your brace. So if you think about it, after a bigger knee surgery like an ACL reconstruction, your quad really shuts down. A lot of times we use your patellar tendon and kneecap bone to help reconstruct that ligament in there. And so if you have a weak quad, there's a potential that you can fall when you're up and moving and walking. And if you do that, you can injure your knee or your reconstruction. So that's why we keep your brace on. So while you're up and moving, we want this brace locked in extension. There's a lock button right here. And it's the same thing on the other side that shows that you're locked. You're unlocked when you flip it this way, and you're locked when you flip it back that way. And so that'll keep you locked in extension, so then you can be without a quad and still walk fine. This right here shows you the motion that you could potentially get with your knee. We want it to be all the way up to as far as you can flex on both sides. And then we'll get you into some activities when you're not up and walking in order to get motion back and to get your quad strength back. So let's go through those. The first thing we can do in regards to strengthening our quad is a thing called a straight leg raise. Whenever we're doing these activities, I'd like you to do it unlocked. So we unlock our brace. So a straight leg raise is where you simply sit either on the ground or on your bed and lift your leg up in the air. This causes your quad to fire and strengthen and waken back up. So we'd like you to do that probably 4 times a day for anywhere between 10 to 20 reps in order to get this quad to start waking up. Another thing you can do is a thing called a towel exercise. And what we do here is we put a towel underneath our knee and we push our knee down into the place that we're sitting. Try to squish that towel underneath it. That causes you to fire that quad and help wake it up. So those are 2 good exercises to work on waking the quad up. The next thing we want is some motion. The goal in motion, when you come back and see me in a week or 2, is somewhere around 90 degrees of flexion. We do that by starting off with heel slides. And so that's where you just take your knee and slowly bend it back. And maybe the first day or 2 after surgery, you only get back to 20, 30, 40 degrees. But if we slowly increase, we can get to that goal of 90. The last thing we'd like to talk about is just simple ankle pumps. And all that does is get the blood moving and flowing around there with the goal of limiting any sort of risk of blood clots. So remember, unlocked when doing the exercises and locked while up and walking. And you can also take this bad boy off when you're going to shower and also when you're sleeping. You don't need them on for those 2 things.